demystifying medicine. Let's continue our past medicine respiratory series. Let's talk about the sarcoidosis. So sarcoidosis is actually the multi-system disorder that involves the lungs, eyes, brain, heart, kidneys, liver, joints, and the skin. So sarcoidosis is a multi-system disorder of unknown etiology characterized by the non-caseating granulomas. It more common affect the young adults in the people in the African descent. So their features are acute erythema nodosum, bilateral hilar lymphadenopathy, swinging fever, and polyarthralgia. Acute form is known as the Lofgren syndrome. Insidious present with the respiratory symptoms like dyspnea, non-productive cough, malaise, and weight loss. Skin, lupus perennium, and it may present with the hypercalcemia. Hypercalcemia, why this occurs in the sarcoidosis? Because macrophages inside the granuloma causes an increased conversion of vitamin D into its active form that absorb the calcium, and hypercalcemia occur. So this is the lupus perennium that appears to like SLE rash, and other one is a erythema nodosum that occurs over the shins. Actually this occurs due to the inflammation of the fat cells that lying underneath the skin over the shin, and it occurs mostly in the different conditions like the IBD like Crohn's, ulcerative colitis, and leprosy, and the different drugs like oral contraceptive pills or the colicine. So it may test in the pharmacological section with the drugs. Either it may test into the Mrcp part 2 as form of a figure in the dermatology section. So it is important. Lofgren syndrome, as I already told, it is acute form of the disease characterized by the bilateral hilar lymphadenopathy, erythema nodosum, fever, and polyarthralgia. It usually carries the excellent prognosis because it involves the erythema nodosum. And other one is the enlargement of parotid and the lagrimal gland due to the sarcoidosis, tuberculosis, and the lymphoma. This syndrome may mimic with the Sjögren syndrome, so don't confuse between the Sjögren and the Mrcp syndrome, because Sjögren has also involved the different glands, but it mainly involved the parotid and the lacrimal gland. But in Sjögren, it is autoimmune disease may associated with the other autoimmune disease, so don't confuse with that. Hayford syndrome, it is a uroparotid fever that is a parotid enlargement fever and uveitis secondary to the sarcoidosis. So sarcoidosis investigation, there's no any diagnostic test for the sarcoidosis. So there are some tests that may be the supportive, like angiotensin converting enzyme levels, that is a sensitivity of 60% and specificity of 70%, and therefore not reliable to the diagnosis, but it may have a role in monitoring of disease activity. So we can assess the disease activity through these enzyme levels. And may the routine blood shows the hypercalcemia in 10% of the patient, and the rest is ESR because it is an inflammatory disease. And the chest X-ray show the bilateral hilar lymphadenopathy, that is a hallmark of this disease. So they are on the basis of chest X-ray divided into the 5 stages. Stage 0, that is a normal. Stage 1, bilateral hilar lymphadenopathy. Stage 2, there is a bihilar lymphadenopathy with interstitial infiltrates, and stage 3, diffuse interstitial infiltrates only, and in stage 4 there will be the diffuse fibrosis. So other investigations are spirometry, as the sarcoidosis is the restrictive disease, so it shows the restrictive defects, and the tissue biopsy that shows the non-caseating granulomas. Tissue biopsy should be taken as a transbronchial. This is a main tissue biopsy is a somewhat is a diagnostic For it shows the non-caseating granulomas. It may test by the RCP in the stem. It may give whole of the stem of the sarcoidosis or the Lofgren syndrome, and may ask what is the diagnosis for that. So you may mention either the tissue biopsy, either they mention the transbronchial biopsy. So go with the transbronchial biopsy. So here's a chest X-ray. You may see there's a hilar lymphadenopathy, and there's a CT scan that shows also the hilar lymphadenopathy with the multiple infiltrates. So it is a stage 2 of sarcoidosis. So how will we manage sarcoidosis? Some is actually just supportive, and other is due to a lot of inflammation, we have to suppress that activity, so we give the steroids. So steroids are indicated in the certain condition, like if stage 2 or 3 on the chest X-ray, if there's a stage 2 or 3 and it is asymptomatic, so steroids are indicated. If it is asymptomatic, there is no need of steroids in stage 2 or 3 if it is asymptomatic. And other one is a hypercalcemia, or the involvement of heart, eye and the nervous system. In the eye, may it present with a facial palsy. Heart may be the restrictive disease like restrictive cardiomyopathy, and the neuro involvement may present with the mass effect or the hypopituitarism. So sarcoidosis has a prognostic features. So factor that associated with the poor prognosis. Remember, this is also tested by the RCP. Remember about these 2 or 3. Insidious onset, more than 6 months, or the absence of erythema nodosum, and the extrapulmonary manifestation like lupus pano or the splenomegaly. Chest X-ray with the stage 3 and the 4, and the black people. So that's all about the sarcoidosis. I hope it may help you in your exam. Subscribe my channel and like my video for the more updates. Thank you so much.